Hi, so the topic of my presentation is physician-assisted suicide, and a case study that I focus on is Compassion in Dying versus State of Washington. So the year of the case was in 1994, and four physicians came into court to testify that they should be allowed to assist in patient death. And the state of Washington countered that and said a person is guilty of promoting suicide and when they aid a terminally ill individual with death. So the court settled the case, and it is unjust to allow physician assisted death. So, as I previously said, the patients were terminally ill, incompetent individuals, so they were able to think for themselves. And a big factor is the loss of patient autonomy versus the ethical duty of the physician. And the purpose of this case was to allow physician assisted death with terminally ill, competent patients. So the two important ethical principles that I focused on was non-maleficence and autonomy. So non-maleficence is to do no harm, and autonomy is the patient's right to self-governance. So with non-maleficence, a physician, when they assist in ending one's life, they are doing the most harm of all by ending the patient's life. Versus autonomy, many can argue that the patient has a right to choose if they want to end their life or not. So there's a lot of controversy with this topic. So the state of Oregon, physician-assisted suicide became legal in 1997 with the Death and Dignity Act. So the Death and Dignity Act is an act that allows terminally ill patients to get prescriptions from a doctor that they can use to end their life. So physicians wrote about 96 lethal prescriptions between 1997 and 2001. And the goal of this was to end the suffering and pain of the terminally ill patients. But since physician assisted death became legal in Oregon, there were about a total of 2,500 people that have received prescriptions under the act. And with that total, 1,657 have died from ingesting the medications. This figure displays recipients in Oregon who received the Death with Dignity Act prescriptions between the years of 1998 and 2019. In the year 1998, 33 people received prescriptions. In the year 2019, 290 prescriptions were written to dying Oregon individuals who qualified for the act. Of that 290, only 188 individuals died using the medication obtained under the law. So, since the first Oregon individual obtained medication under the law in 1998, a total of 2,518 individuals have received prescriptions under the Act. Of that 2,518, only 1,657, or roughly 66%, have died from ingesting the medications. So, even if an individual does ingest prescribed medication to end their life, sometimes the medication isn't strong enough or it just doesn't work.
So, my thesis statement is although patients have a right to self governance, a physician's duty is to preserve life, which precludes prescribing medications with the intent to facilitate a patient's death. So, even though patients do have the right to choose what they want to happen with their end days, the ethical duty of the physician is to be a healer. And when prescribing medications to hasten their patient's death, that just goes against your ethical duty as a physician.